Bismillah ar-Rahman ar-Rahim. I'm Dr. Mohibullah Wazir, and the topic is the deep fascia. Look, deep fascia. Note again. Look, first is the skin, then is the face, and then is a thick white sheet around, and this thick white sheet made up of white fibrous connective tissue that surround these muscles. This is called a deep fascia, and the skin is connected to the deep fascia by white fibrous connective tissue. When you remove the fats and remove the skin, then you will see a thick white membrane. This thick white membrane is called as the deep fascia. It is well developed in the limbs and it surrounds the limb muscles. You can't see the muscles until unless you remove the deep fascia. And in the other parts of the body, the deep fascia is present but not so well developed. Over here, when you're in the pectoral region, first is the skin, then is the superficial fascia, and if the female, the breast tissue, when you remove the breast tissue, then there is a thick white sheet that overlies the pectoral muscles, and that is also called as pectoral fascia. That is actually the deep fascia. And in the axillary region, over here, there is also deep to the skin, there is a deep fascia, thick deep fascia, which is also called as axillary fascia. That is also the deep fascia. Now, the deep fascia is again a thick membrane that surrounds the muscles, and also you can see the bones and also the blood vessels and nerves. These are all being surrounded by the deep fascia. What for? To protect them, to keep the muscles and the nerves in its own place. Somewhere, the deep fascia is in the body. It has the characteristic that anywhere it finds the bone superficial, it immediately fuses with it. For example, you can see over here the tibia medial surface is being not covered by muscle, it immediately fuses with it. Over here to the lower end of the radius, in the same way, anywhere over here the clavicle, anywhere any bone not covered by muscle, it is immediately the deep fascia become fuses with it, while around the limbs, around the muscles, it make a thick deep sheet, and it not only make a thick deep sheet around the limbs, but it sends septa. Now let us see over here. This is the bicep brachialis, and over here is the humerus bone. Over here is the deep fascia comes like this, and a septum from it takes the medial border, and in the same way to the lateral border, and in this way, these intermuscular septum, it separates this anterior group of muscles from posterior group of muscles. In this way, in different in the parts of the limbs, the deep fascia, in addition to its function keeping the muscle in its own place, that it also sends intermuscular septa to divide the different muscle groups from one another. For example, in the thigh, over here it separates the anterior group from the medial group, and then from the medial group from the posterior group. These muscles separate being by the intermuscular septa, which is an extension from the deep fascia. Then the deep fascia is also, some people call it as the epineurotic deep fascia. In somewhere, the deep fascia, it is epineurosis of the muscle. I explained in the muscles that it is a sheet made up of white fibrous tissue like the deep fascia, and it is used for the insertion of the muscle. So a thick sheet of fascia or a thick sheet made up of white fibrous tissue used for insertion of the muscle, it is called as epineurosis, and people call it as epineurotic deep fascia. While the muscles are it being surrounded by again by white fascia, but it is less thicker than the deep fascia, and that is being called as epimysium. And a fasciculus is being separated, that is being called as perimysium. And one muscle fiber that is endomysium. I have explained that in muscle, endo, peri, and epimysium. These are also, people call it, it is the subclassification of the deep fascia. And then the tendons, which are a rope-like structure made of fiber tissue, and then ligaments. People also include it in the subtypes of the deep fascia. This is the recent classification. And while the visceral and parietal fascia, it is actually, for example, the visceral layer of the pleura and parietal layer of the pleura, visceral layer of peritoneum and parietal layer of peritoneum, visceral area pericardium and parietal pericardium. Now the people also include, because there are also white sheets made of white fiber tissue, they include also these in the subclassification of the deep fascia. Then the deep fascia is actually not elastic like the skin. It is not elastic like the skin. It is of course flexible structure, but it is not elastic. And the deep fascia is having a good nerve supply and blood supply, and it is a sheet which you can cut and we can root stitch, while a superficial fascia is not a sheet, and that's why it does not deserve the name of the fascia, but it is being still called. So the deep fascia is having a proper nerve and blood supply. It is a proper sheet. This is all about the deep fascia. Thank you very much.